Hi, y'all. Happy New Year. My name's Amelia. I'm an occupational therapist, and I want to talk to you today about bed sores. Bed sores, also known as wounds in healthcare, sometimes we call it decubitus ulcers. It's just different names for the same thing, right? But I really want to talk with you about bed sores today, especially if you're a family caregiver, because these are things that, of course, we are afraid of having happen. We understand that the consequences of getting a bed sore or a wound can be really, really high. But a lot of times we miss the early warning signs. And I know this because I've seen it so many times in my clinical practice as an occupational therapist, where maybe I'll be called in to do an evaluation or perhaps to do a follow-up session. And I'm not there to look at skin or deal with wounds or anything at all. But I will find the signs and symptoms of them that are just going unnoticed. And it's actually really simple. There are a couple of super simple things that you can be looking for early stage wounds so that you can report them to the healthcare provider for the person that you're caring for before they become a huge open wound. So first thing to know, right? Bed sores can be caused by three basic things. The most common things that cause bed sores are pressure, prolonged pressure. It doesn't have to be heavy pressure, especially when someone's skin is really delicate and they're not moving around a lot. Just that prolonged pressure can cause a bed sore or a wound. They can be caused by excessive moisture or being left in moisture for a long time. Again, it doesn't have to be super long when people have delicate skin or frail skin and they're not able to move around a lot on their own. And it can also be caused by friction. So the movement of maybe the bed sheets or wiping a lot or something moving back and forth on the skin a lot. That kind of friction can also cause skin breakdown and wounds and or bed sores. So how do we recognize the early signs of this? One of the most important things to know here is that bed sores or wounds can be developing before the skin has opened. Right? So before the skin opens up, before you see a skin tear, or there's an obvious hole in the skin, or there's any bleeding or anything like that, wounds actually start to develop before that point when the skin is closed. And there are a couple, like I said, there are a couple pretty simple warning signs that you can be looking out for. The first is if you touch that skin and the skin doesn't blanch. Now, what I mean by blanching is when you press down on skin, it will temporarily lose its color, right? That's because you are temporarily pushing the blood out of that area of skin. And then the capillaries, the blood vessels in there, they refill and it brings the color back. So that part where it turns white, that's blanching. And the part where it fills back in, you don't need to know about that, but it's called capillary refill. You don't really have to worry a whole lot about that. Just worry about the blanching, okay? So if someone has a red area, say on the top of their toe or the bottom of their heel, or one of these other really common areas where bed sores or wounds can develop, if you press into that red area and it doesn't turn white, that means there's the beginning stages of a wound there because there's been enough damage to those blood vessels there that they're not emptying and refilling. So again, if you're pressing in and it's not turning white, it's not blanching, then that's the sign of an early wound developing. Super simple to look for, super simple to do. The second thing that we want to be aware of when we're looking for early stages of wounds. Again, this is really simple. And a lot of times you'll see this on people's heels, which is a very common place for wounds to develop because heels, in someone who's not moving around a lot, heels are sitting on the back of the bed or they're sitting on the bed. Or maybe that person is rubbing their heels back and forth on the bed. So we've got pressure and we've got friction there, right? So what will happen is you might see those heels turn red. Someone might complain of pain if they're able to verbalize and complain of pain. If they're not, we need to make sure that we're really checking out these things, that we're really keeping an eye on them. If someone can't tell us verbally if they're actually having pain in an area. So you might see that their heels are red or something. And what you can do is, again, you can push those, you can see if they're blanching. But the other thing that you might look out for is to see if that skin feels mushy. You know, if it feels like it's not as firm as it should be, if it feels kind of mushy, and I know, technical term, right? I have actually documented mushy, probably not the most professional term to use, but it kind of is very descriptive. If that skin, again, particularly on the back of the heels, if that area feels mushy instead of firm, that's another sign that there might be a beginning stage wound developing. So we don't want to wait for wounds to be open. We want to recognize them as early and often as we can. Of course, we want to prevent them as much as we possibly can. If you're looking for information on preventing wounds, there is a whole course on higher standards caregiver training that is all about methods of preventing these types of wounds or pressure sores, bed sores. So you can definitely check that out there, because we do want to prevent this from happening in the first place as much as possible. But we also have to recognize that early recognition of wounds is key in preventing them from developing into a bigger issue. So if you do see something like this, if you're caring for someone and you think that they might have a wound developing, then of course you want to make sure that you're taking actions so that that wound doesn't get worse, you know, avoiding more pressure on that area, avoiding excessive rubbing on that area, avoiding excessive moisture on that area. But most importantly, you need to be reporting it to the healthcare provider for that person so they can take immediate action to do whatever needs to be done for that wound so it doesn't get any worse and to allow it to heal. Don't take trying to treat someone's wound into your own hands. Please, please make sure that you're reporting it to their healthcare provider, because there are wound care experts and professionals. I'm not a wound care expert. Mostly I identify these things and then I hand it off to someone who is a wound care expert. But there are wound care nurses, there are wound care therapists, there are wound care doctors, and we want one of those people who are experts to be handling this so that it doesn't develop into a worse situations. Guys, if anything that I said during this reminds you of a situation that you think needs to be assessed or addressed by a licensed healthcare provider, please make sure that you are reaching out to the healthcare provider for the person that you're caring for, so that provider can come in, take a look at the situation, and decide what needs to be done. Because this is not a substitute for a therapeutic relationship. This is not a substitute for health or medical advice for you or the person that you're caring for. You do want to make sure that you're reaching out and getting help from the provider for that person. Okay, so that's what we're going to talk about today. You may have noticed, if you're a follower, if you already follow, you may have noticed that we didn't do 10-minute 2-tip Tuesday today. And that's because we're taking a new turn at Higher Standards Caregiver Training. 10-minute 2-tip Tuesday is going to be retired for the year. And what I'm going to do, I'm partnering up with a great, an absolutely fabulous organization called Whole Care Network. We're creating something called Whole Care Network University. And as part of that, this year, we're going to be doing a question of the week, because I want to be responsive to the actual needs, the actual information that family caregivers are out there looking for. So how is question of the week going to work? Basically, you can submit a question, you can respond to a post, and you can respond to the question of the week before, and you can ask a question right there openly on social media. Or if you want some more privacy, if you would like to be anonymous in your request, or you just don't feel comfortable posting it right out there on social media, you can you can fill out a really quick questionnaire. It's literally like, what's your question for the question of the week? And if your question is selected to be answered for the question of the week, then I will go ahead and answer it for you that following week. That's going to be most of the time live on Tuesdays at 3 p.m. Central Standard Time that those questions are going to be answered. If your question doesn't get selected, I'm going to do my best, and the folks at WCN University, Whole Care Network University, are going to do our best to connect you with any resources to help you answer those questions and get the resources that you need. So please don't be shy. Make sure you're putting those questions in there so that you can get the answers that you need and get connected to the resources that you need. I'm going to be posting the link to go ahead and start submitting questions for question of the week, along with this video here on wound care. So make sure you're taking that advantage of that. And of course, like I said, you can also go ahead and submit a question in the comments that go, or in the chat that goes along with this post too. To make sure you're getting updates, please make sure that you are following, liking, and subscribing so that you can make sure to get notified when the answers to the question of the week are coming up, and so that you can watch what those answers are. So till next week, y'all, please stay healthy, stay well, take care, and I cannot wait for what 2023 has in store for us. We're going to answer tons of questions. We're going to be bringing you tons of resources through Whole Care Network and Whole Care Network University. Cannot wait, guys. So until next time, please take care. Bye, y'all.